For those of you that aren't familiar with the Center for Urban Community Services, where I work, we're a direct service provider here in New York City. We serve about 25,000 individuals and families annually in a range of different kinds of direct service programs. We also run a national training and consulting program, and that program enables us to reach about 10,000 staff at human service programs across the country each year to help them build more effective programs. So I'm here today to talk about our Home to Stay program, which we're very excited about because it's pretty unusual in human services to have the privilege to be able to do a randomized controlled study and be able to know for sure whether or not the intervention that you're using is having an impact compared to a control group. And with the Home to Stay pilot, thanks to support from the Robin Hood Foundation, we've been able to do that. And we can say that we know that, in fact, this particular model improves outcomes for homeless families compared to what they get typically in the New York City shelter system. So the Home to Stay program provides transitional case management services to families who have experienced multiple episodes of homelessness. And it really does a couple of key things. First, it works with those families to help them to build the income that they need to be able to move out of shelter into primarily market rate housing, because right now, as those of you from New York City know, there are no housing subsidies available for families exiting shelter. We work to help them identify an apartment and move them out as quickly as possible. And then once they're in the community, we provide case management support using an evidence-based model called critical time intervention that links them then to the community-based service providers that are available in their area, so that when the Home to Stay case management services are no longer available, they've got somebody to go to help them stay stable in that housing. So I mentioned already the program funded by the Robin Hood Foundation. I just want to acknowledge Kristen, who's here with us. So we're very grateful for their support. And we work also very closely with the New York City Department of Homeless Services. CUCS manages the program on behalf of the Robin Hood Foundation. Are there any Home to Stay staff, folks that are working in a Home to Stay program in the room? Okay, I just wanted to acknowledge the staff, because they're really the people on the ground that are making this all happen. And there are 4 different agencies that are sponsoring Home to Stay's teams. One of them is sponsored by us, and then Community Solutions, Jericho Project, and Women in Need also have teams. And collectively, those 4 teams serve 120 families at any given point in time. I wanted to talk a little bit about who we serve and why we decided to serve those particular groups of families. And the first thing I want to say is that when we started the project, it was when Advantage vouchers still existed in New York City. And so when we started the projects, we were working with families who were Advantage certified, and it was much easier to move them out of shelter because they had a subsidy. Once those Advantage vouchers went away, we began working with families who had some base of income in order to be able to move them out. And so currently, the income requirement for participation in the program, because the program does not offer any rent subsidy, it's just a case management program, is that the families coming in, for the most part, need to have 100%. Their income needs to be equal to at least their estimated market rent. And then in addition, we're really focused on working with families who either have had 2 or more prior episodes of homelessness, so this is their 3rd go in shelter, or who had been in shelter at least once previously and exited with a subsidy but came back to shelter anyway. And so the reason that we're serving that cohort is that we know that nationally, the research really says that subsidies are what it takes to end homelessness for families. And that much of the research says that the addition of services doesn't seem to make a difference, that it's really the subsidy that matters. And so we wanted to work with families for whom the subsidy, for whatever reason, wasn't enough and they came back. Secondly, we're working with families who are episodically homeless, right? So they've been in shelter. This is now their 3rd time. And the reason for that is, again, because the national research by Dennis Culhane and others really shows that unlike the single homeless, single adult homeless group, among the families, it's the episodically homeless who are most likely to have intensive service needs. So a lot of us know about the research that Dennis did on the single side, where, there's a lot of talk nationally about the chronically homeless singles, right? And in that group, those are the families, those are the people that have the most intensive service needs. But in the families, actually the episodically homeless are almost 2 times more likely than the long-term homeless families to have intensive service needs. So that's why we focused on those folks. So I want to talk a little bit about what makes Home to Stay, what are the core elements of the model, and what makes it different than services as usual in the New York City shelter system. And the first thing is what I just mentioned. We're focused on a very particular cohort, that recidivist and episodic group. We are also very focused on engaging families rapidly. So from the time they are referred to us, the providers, the teams, need to get out there, assess them, and enroll them within 10 days. And so oftentimes that takes multiple attempts to engage them. So it's not just they go out once, they normally go out several times before they're actually able to connect with and engage the family. Our caseloads are lower than the New York City shelter system. So our caseloads, it's an intensive time-limited model. So the caseloads range from about 1 to 10 to 1 to 15 families per worker. In the New York City shelters, the caseload range varies quite a bit, but at best it's probably something more like 1 to 25. Finally, and I think this is really key, our program uses 2 different evidence-based practices in our approach to how we deliver services. The first is motivational interviewing, and the second is critical time intervention. And we're not going to have time today to really go into detail about those, but I'm happy to talk to anyone after that's interested. And then we also, and I think this is important to note, we have continuity of services, meaning that from the time that we engage the family, through helping them to find an apartment, moving them out into the community, connecting them to those community-based providers, and ultimately graduating them from the program, through all of those different phases, the client, the family, is engaged with a single caseworker. As opposed to in the shelters, once families move out, if they need ongoing aftercare services in the community, they generally need to get those services from a different entity. So there isn't that continuity of services. And then lastly, we use a robust data-driven management model, which I'm going to talk about now. So there are 2 primary outcome indicators that we track and manage through the Home to Stay program. And the first one is income. So we all know that without a subsidy, for the most part, families need income in order to be able to afford an apartment. And so that's really the key thing that we're working with families around while they're still in shelter. And our goal is so that they have to pay no more than 50% of their income towards their rent. So that means that if their rent is $1,000 a month, we have to work with them to get them up to $24,000 a year in income, which is difficult given the job market. The next outcome indicator that we track is graduations, and we are contractually obligated with the Robin Hood Foundation to collectively achieve 120 graduations per year. So that means we have to turn over our entire caseload every year. And how we define graduation when families are ready to graduate is basically when they have enough income to be able to continue to pay their rent. They've got no evidence of utility or rent arrears. The provider is confident that, given their circumstances, they're going to be able to continue paying their rent in coming months, and those community linkages have been established, so that there's some place where those families are going to be able to go, a service provider that they already know that's going to be able to help them if things go bad after they're no longer part of the program. So we also track a series of process indicators, which is how we know and the staff know that they're making progress towards meeting those outcome indicators. So I'll just give you a couple of examples. The first one is we track very closely the number of days to screening because we are trying to engage families as rapidly as possible. And then secondly, we track the enrollment success rate, and we're very successful at enrolling eligible families. So our target is 100%, and we come very close to hitting that target among eligible families. And then we also track days to move out from shelter because we're, again, trying to get people out of shelter and into the community as quickly as possible. And we, of course, are tracking progress towards the income target. And that income includes all kinds of income, earned income, entitlement income, child support, any kind of income that you can think of, including off-the-books income. And we do that using a client-level data management tool that I'm going to talk about in a minute. So the goal of all of this data tracking isn't just data for data's sake or data because Kristen wants it at Robinhood, right? It's really data because the purpose of collecting all this data is really so that we can collectively know how well the program is performing and continue to strengthen the performance day in and day out. So it's a continuous quality improvement model. We're accountable to the funder for the outcomes, and we use a real-time data tracking tool at the case management level that for every client that's involved tracks a series of indicators, right? So that on any given day, that case manager and the supervisor to whom that case manager reports knows exactly where the family is towards meeting the outcome indicators, and also knows what are the most critical next steps that the family and the case manager need to take together to achieve those indicators. So it's a way of helping the on-the-ground workers really have a laser focus on the most important things they need to do next. And then we also aggregate those data on a monthly basis and share that transparently across teams. So every team, vis-a-vis the other teams, know exactly how they are performing and how that performance compares to all of the other teams. And in those data reports, again, the purpose is not so that your boss knows or so that the Robinhood Foundation knows or DHS knows. Those are important purposes, but it's also so that the data is easy to use for the worker on the ground. So we're continuously engaged with the teams on the ground to make those reports easy to use and relevant to their work. And of course accurate, because we all know that bad data does no one any good. And then those reports are reviewed at every single level. So between the case manager and their supervisor, the supervisor and the program director and the agency executive to whom they report, all the way up to our funder. And all of us collectively, including the folks at the Robinhood Foundation, are engaged in dialogue constantly about what are the data telling us and how can we, at the case level, to the team level, to the program level, continue to make the program stronger and stronger. So I wanted to share a couple of our outcomes with you. So since the inception of the program, we've graduated 171 families. And that's really in the last 2 years because the first year we were really focused on starting up and enrolling families, and so we didn't have a graduation target until the second year of the program. And then these are the results of the study that I mentioned earlier. And I wanted to make sure to mention that this is phase 1 of the study, and so these results are from when the Advantage vouchers still existed. And we are currently engaged in phase 2 of the study, but do not yet have data available for phase 2 of the study. But the study did show that home to stay, when compared to a control group that was getting services as usual, outperformed those services as usual. And so the first result that we're showing here is that 73% of our families exited shelter with subsidies compared to just 56% of the controls. And we know that's significant because we know how important subsidies are for homeless families. The second point is that our families exited shelter more quickly and returned to shelter less frequently than the control group. And when you look in total, each family spent 73 days, so more than 2 months less in shelter than comparable families in the control group. Now that data point is if you look as a whole, everyone in the home to stay in the experimental group and everyone in the control group. We also broke down the analysis to look at 2 cohorts based on how long they had been in shelter. And when you looked at the early entry cohort, so people who had been in shelter for less than 6 months from the start of the pilot, for those families, our impact was even more significant. So for those families, they spent 124 days less in shelter than the control group. So that's more than 4 months. So that's really significant in the lives of homeless kids and homeless families. One thing that's important about the results is that, oh, sorry, I forgot to advance the slide, is that when you looked, I said that our impact was greater for those recent entry families. When you looked at our impact for the families, the cohort of families who had been in shelter longer, we had a little bit of an impact, but it wasn't statistically significant. So that's, I think, a really important lesson about the value of rapid rehousing. So this study really showed that, that when we engaged with people sooner, those people did better. The other important thing to know about the results was that home to stay was more effective at preventing recidivism, primarily because we were more effective at getting people those subsidies when those subsidies were still available.